Good morning. I am Lynn Babington, and welcome to our celebration of National Public Health Week. And joining us for a healthcare forum, looking forward, building a healthy community after COVID-19. I'm the president of Chaminade University of Honolulu, and it's my pleasure to welcome all of you here today. We've gathered a group of local experts to have a discussion looking forward of how we can build a healthy community in Hawaii. We will discuss healthcare needs, public health infrastructure, and healthcare workforce needs. Now, as many of you know, Chaminade University educates healthcare professionals through our Bachelor of Science in Nursing program, our Bachelor of Science in Community and Public Health, our Masters of Business with a focus on healthcare, and we'll be launching a Doctorate of Nursing Practice program in the fall with specializations in family nurse practitioner, psychiatric mental health nurse practitioner, and nursing leadership. So I would like to begin today by introducing our panel. Today, we are very honored to have a distinguished group of panelists. We have Lieutenant Governor Dr. Josh Green, who is a practicing emergency physician on the Big Island. We have Dr. Jill Hoggard Green, who is the CEO and president of the Queen's Medical System or Healthcare Systems here in Hawaii. We have Dr. Mary Frances Oneha, the CEO of the Waimanalo Health Center, and we have Mr. Hilton Raethel, who is the president of the Healthcare Association of Hawaii. So I'm going to begin by posing some questions to our panel. Audience, please feel free to type your questions in the question box on your screen. So let's begin with a very general question that I'd like all of you to answer. Lieutenant Governor, why don't we begin with you? What will our community need as the pandemic resolves?
Well, thank you for having me. I so appreciate it. Boy, the pandemic in some ways changed everything for 18 months for us, and it exposed incredible vulnerabilities, but all of our main needs remain. And I think we're going to continue to need healthcare providers. We will realize that when the pandemic comes and goes, we'll still have our healthcare provider shortage. So it's particularly good that programs like Chaminade are ramping this up and creating more nurses and nurse practitioners and nurse PhDs and so on. So I think we're going to continue to have a healthcare provider shortage, and we're going to have to use whatever technologies we developed as a result of the COVID crisis to further increase access. So hopefully we will hold on. I know these are questions coming up, but we will hold on to the solutions that worked, like telehealth, where it really ramped up. I think it's our healthcare provider shortage is going to continue to plague us.
Thank you, Josh. Now let's hear from Dr. Jill Hoggard Green.
Thank you, Dr. Babington. It's a pleasure to be here. It's a really good question. And I start with, I think we're in the fourth quarter. I love basketball, so I usually use that metaphor. I think we're in the fourth quarter of the pandemic. We still are at a very vulnerable time. We need to continue vaccinations very rapidly, and we've got to make sure we're still wearing our masks and all those protective activities, social distancing, washing our hands, so that we can get to a point of normalcy. But that normalcy is going to be a new innovative point. I think one of the things that as we step out of this, we have learned so much. And the innovation and the ability for us to lean in between government and business leaders, healthcare providers, and all of our communities have made us demonstrate that we can do so much more. So as we step out of the pandemic, clearly we're going to need to support our schools. We're going to need to support our public health infrastructure. As Dr. Josh Green has said, as Lieutenant Governor has said, we definitely need clinicians, and it's so heartening to me to see the number of people applying to nursing school, to pharmacy, to be physicians. We need the next generation, and we need a lot of innovation, which is something we developed as we developed an inner soul that said we can do this and we can do it rapidly. So I'm very excited about the opportunities going forward. The last, though, for me is also heart-wrenching, because we really saw the impact of health inequities in our community. So there's a tremendous amount we need to do to resolve those healthcare inequities and assure that everyone has the level of health care and the support and having a life well lived and their health and well-being improved.
Great, thank you, Jill. We're going to get to the health equity question in a few minutes. Dr. Oneha, would you like to share with us your thoughts?
Yes, sure. Thank you for the question. So just to build off of what both Dr. Greens have already mentioned, certainly continued addressing and resolving of disparities that have been exacerbated as a result of COVID-19. And that includes like access to care, housing, and increased broadband access. I think in addition, just at a very local level, is having the community support businesses so that they can continue to open and improve and reduce the unemployment. I think a third area for me is, there's been a number of community organizations who have stepped up to respond to COVID and to respond to some of the social determinants of health. If there is a way that we can sustain that network and that infrastructure that came out of COVID, I think that would be great in helping to move us past the pandemic.
Thank you, Mary. Yes, taking advantage of all of the, as Dr. Jill Green also indicated, the community support and bringing together different sectors within our economy to work together in innovative solutions is a real opportunity for us. Mr. Raethel, can you share with us your thoughts?
I believe we'll need ongoing vigilance about both COVID and potential pandemics. This pandemic is life-changing. It has literally changed the world, and it's not going away. So we are getting very close to vaccinating, we're a couple of months, 2 to 3 months away from herd immunity in Hawaii and probably in the United States. But the pandemic or COVID is going to be endemic. It's going to be prevalent in our society on an ongoing basis. We don't know what's happening with the variants, where they will end up, whether their booster shots will be needed. We still have all of our kids to vaccinate, about 220,000 just in the state of Hawaii. So we are going to be dealing with this, and we need to be aware that as we get through the worst of this, because it's still out there in the community, we need to be able to stop outbreaks when they come up. We need to be able to do ongoing testing. We may need to get everyone booster shots. We don't know that yet. We don't know if a booster shot is necessary for the variants. We don't know if a booster shot may be necessary to prolong the efficacy or the effectiveness of the vaccines that are out there. So we again will need to be mindful on an ongoing basis for months, if not many years to come, of the impact of this pandemic and of potential other viruses that may come out in the future.
Great. Thank you, Hilton. You're right. Lots of challenges ahead. Dr. Jill Green, as the CEO and president of the Queen's healthcare system, your health systems experience increased healthcare needs directly related to this pandemic. We've all read about early on hospital beds and ICU beds, as well as ventilator capacity. But what are your thoughts on what chronic health conditions will need additional support and resources moving forward as a direct result of COVID-19?
Thank you for that excellent question, because it's one that's on all of our minds. Clearly, we saw individuals that were impacted with COVID and had both strokes and heart disease and had pneumonias in ways that we hadn't seen before. And that will continue. Those are things that we need to continue. But what we also saw was people weren't coming in when they really needed to come in. So individuals with strokes were waiting a bit to say, is it safe to come into the hospital? Individuals were not getting their screening. So for cancers, we're very worried that we have a lot of undiagnosed disease that under a normal protocol, we would have been identifying early and treating early. So as we look at both cancer, which I consider a chronic disease, we got to carefully focus on getting everyone in for screening, assuring that we're catching up and making sure that we're identifying and treating earlier. We also know that with diabetes, heart disease, and cancer and strokes, there's so much we can do if we can identify it early, And if we can actually start with good health behaviors, but even if we screen and can identify it early, we need to support individuals in managing those diseases. And last with that, while health providers are essential, when it comes to chronic diseases, 90% of the care is the individual providing their care to themselves. So how do we support you and your ohana in helping you live the healthiest life with your diabetes? Those are things that we're really focusing on of how we do that going forward. But clearly chronic diseases are increasing, and there's some that people didn't get treated early enough because I think they were afraid of coming in.
That's a very good point. And I think that brings up the real need for community health workers, for health educators, you're right, to be able to support and educate individuals and families to achieve their highest level of wellness. Dr. Oneha, what are you seeing in the community?
Yeah, so I see similar to what Dr. Green just shared, but I think, aside from chronic diseases, there will need to be extra effort put into childhood vaccinations and re-engaging those families back into preventative care. Certainly with COVID, they were not coming in for preventative care. There were many times where we were closed to that. So I think re-engaging families and children back to preventative care to help bring our childhood immunization rates back up to where they need to be will also be very important.
Yes, we can't forget our keiki because they are our future. We know that. Now, we've learned some lessons through this pandemic. Hawaii continues to be challenged with providing equity in healthcare access, and we've already alluded to this several different times. So Lieutenant Governor, why don't we start with you in addressing this question? How do we build and sustain a public health infrastructure that supports health and equity and access to care?
So that's the million-dollar question now.
Yes.
We're going to have an additional challenge, which is that deep budget cuts often hit those who are economically disadvantaged the worst. And also, after many years in the legislature, I noticed that the more rural our communities are, the less access that we have, not just because they're rural, but also because there is definitely an Oahu-centric focus, which means that more resources get centralized. It's not nefarious. I think that it's because people do what they know, and there are a million people living on Oahu. But if we learn any lessons from this, I hope that we will learn that we have to spread out a public health infrastructure if we don't want to have challenges that affect the rest of our state. As we've seen, some of the neighbor islands, when they have outbreaks, it affects all of the state. And so it speaks to the need to be able to absolutely respond to these public health crises wherever they are across the state. I think that very troubling to me, for example, is the raid on the Tobacco Trust Fund. Former Governor Cayetano spoke eloquently about that today. That is a mistake. Now, we may need resources to be moved around a bit, but to raid it completely and to take away dollars that go to statewide public health initiatives will have far-reaching consequences that will be paid for in the long run. And these shortcuts will not be helpful. So what I would do is I would actually take this opportunity to make the case for a statewide public health infrastructure being rebuilt, got kind of deconstructed over the last 20 years. And that's where we need to fund extra programs, education programs, specifically positions in the rural areas. A lot of the community care workers, great opportunity for us to put that on steroids.
Great, thank you. And Mr. Raethel, you represent healthcare organizations throughout the state. And so you have the small rural areas as well as the large healthcare institutions here in Oahu. What do you think about public health infrastructure and equity?
It's a huge challenge around not only in Hawaii, but nationally and around the world in terms of creating equity. Tertiary medicine is very expensive.
Nope.
It is a real challenge getting equal access to care to different sections of the population. If you talk about a neurosurgery program, for example, or a cardiovascular surgery program, you need just not the physicians, you need the nurses, you need the equipment, you need the technicians. And there is not enough money in the system to be able to put all of these types of services in every community across the state. And especially in Hawaii, we have those unique challenges of the geographic barrier, which is the ocean that separates the islands. Most other places you can just drive, you know, and it's not that big a deal to drive, or it is doable to either drive or get medevac or whatever to certain areas. But you know, we can medevac people here, but you certainly can't drive from, you know, from parts of rural Maui to Oahu, for example. So there are some real barriers that we have here. One of the things that this has reinforced is the push that has been on for the last number of years in terms of primary care and preventative care. And we as a nation have not spent enough time on primary care and preventative care. We have world-class resources when you talk about technology, surgery, interventions, our labs, our scanning, our robots. So we do a lot of things incredibly well. What we don't do as well, or what we have not done historically, is that focus on preventative care. And you know, Kaiser has a history of doing this. HMSA has taken this on in the last few years as well as a major initiative, as have the other plans like UHA, for example. So there is a much increased focus in the last few years on preventative care, primary care. I believe we need to even move more in that direction. We still need our tertiary facilities. Obviously, when people have strokes, when people have car accidents, when people have major trauma, we need all of that, but we need to invest in our communities. And if we invest in our communities and in resources in our communities, which are much less expensive in terms of the preventative side and the primary care side, then that benefits all of the state.
Yeah, well, you're absolutely right. And as Dr. Josh Green indicated at the beginning, we continue to have a growing shortage of primary care practitioners here, thus no access to primary and preventive care. Particularly physicians, and we've seen a growing need for mental health services, particularly during this pandemic at all levels, from keiki to kapun. They're just, everybody seems to need support. We know that a primary care delivered in a team-based model is the most efficient and has the best outcomes, and that's a physician, nurse practitioner, or physician's assistant in a team-based model. We don't do as good a job as we might here in Hawaii, but we've seen some real success. And those teams have also been using telehealth, as we talked about earlier. So our next topic really looks at the healthcare workforce. How can we best prepare a healthcare workforce to care for our patients, inpatient, and our community populations? Dr. Jill Green, why don't you share your thoughts on that?
Thank you for that great question, because it's so timely. I think you started it when you said, we know that the research says that the evidence says that if we work in teams, we are much more effective, and you're correct. We need to, as we think about how we're going to care for our whole population, and I think of it as we need to be lifetime partners to individuals, and Hilton was correct. We don't have enough primary care clinicians to be the partner. As we think about team-based models, if we have physicians, nurse practitioners, and I believe social workers and psychologists, that early research in the 90s said if you have a team-based approach, you'll be able to meet the holistic needs of the individual much more effectively. And with telemedicine, it expands dramatically. During the pandemic, before the pandemic, we would do about 400 telehealth visits a month at Queens. The month of April, a year ago this month, we did 14,000. So we know we can use technology, and we had the majority of people that we were working with had access to technology. So as we come out of this pandemic, our ability to create in rural communities, in small communities, the combination of teams, physicians, nurse, social work teams, and having them connected to specialists through telemedicine, and bringing that into their clinics and into the home, there is a dramatic opportunity for us to improve access and personalize the care and create those lifetime relationships. So I believe it's one of our greatest opportunities, but we have to educate. And I'm so happy to hear about your DMP program. We need nurses, doctorally prepared nurses that are practitioners, the APRNs, we need PAs, we need psychologists, we definitely need nurses. And we did need to bring on island over 100 nurses during our surge because we did not have enough. So we definitely need to ensure we do that in the future.
Yes, yes, that's a very critical, educating a varied workforce with multiple skill sets that stay in Hawaii is very important. But all of you have alluded to some of, this is National Public Health Week, so we talk about the social determinants of health. So the social determinants of health are really defined as economic and social conditions that influence either an individual or group differences in health status. In Hawaii, there's been a big spotlight on this. We know that some of our populations have been hit harder by COVID, have had worse outcomes by COVID. Currently are not in the high vaccination groups. And this is something we seriously need to address. So how do we begin to address this? Dr. Oneha, you see this every day in your community in Waimanalo. What are some of your thoughts on how we can move forward in a much more proactive and innovative way?
Sure, thank you. Thank you for the question. So I think COVID, as I mentioned earlier, certainly exacerbated the social determinants of health that already existed in the community. So COVID didn't create it, they were already there. I think one of the prime determinants that I think really needs to be addressed so that it occurs on a consistent basis is in-language resources. Just the messaging, the materials, everything that goes out to communities related to health, healthcare, access to healthcare, everything needs to be in language, needs to be accessible in language. So whether that's on a website or whether that's manually delivering it to them. And along with that is an understanding who are the influencers or the deliverers of those messages. And how do we ensure that their voices are being heard at the table or in the materials that are being developed for these populations? So I think that's really critical. I think it's something that we learned in being very conscientious of the in-language materials to be sure that they were not only linguistically appropriate, but culturally appropriate, that they were made accessible in a culturally appropriate way, that they were being delivered in a culturally appropriate way. So whether that's by their medical provider or by the pastor at the church, I think that whole spectrum we need to continue moving forward. I think there's certainly some other determinants. I'll just raise one other example, and that's related to housing. As I think everyone on this panel knows, those who live in public housing or high density housing had far more challenges than others. I think understanding for healthcare professionals to really understand the context in which individuals in our communities live, and how do we begin to address that from a public health perspective? How do we get the appropriate resources to those communities or public housing aggregates or those people living in aggregate settings? How do we get the resources to them in an efficient manner and in an appropriate manner? So I think those are the two determinants that come to mind, aside from food insecurity and many others. But those are the two that come to mind that I think will be well worth us trying to continue to sustain that network of support.
Yes, yes. Oh, you're absolutely right. It kind of goes back to Maslow's hierarchy of need. Yeah, food, housing, meaningful jobs that pay a living wage, and that all impact, not just impacts, but totally influences your health and wellness. Lieutenant Governor, how are we addressing some of these issues at the state level?
Well, we're not. That's the problem. So, we have not put in a mandate for housing, which there has to be. There has to be universal housing for people. We have about 12,000 individuals that are housing insecure to homeless every, at all times. And we have another whole swath of people that are somewhere living at or near poverty that are sharing housing with, an extended family setting, that are really not too far from becoming houseless. So we haven't done that yet. That's one of our largest failings. We also saw food insecurity surge 60% during the pandemic. And so it just shows you how many people are living near the edge. We had already been recognizing that right before the crisis, and then it blew up. So we're going to have to decide once and for all whether we're going to actually have a living wage in the state of Hawaii for people, so that that group of individuals living at or near desperate poverty don't have to worry about the foundational needs. If we decide to take care of that, we will be in a very good spot. There is enough money, period, in Hawaii to accomplish that. But that is the biggest question. So, I'm actually starting to use the term social health, which is that triangle: access to healthcare we talked about, housing, food security, which the state is going to have to really take on. And frankly, that plus living wage gets you there. Interestingly, and I'll kind of stop my comment after this statement, but interestingly, we uncovered a very clear reality before the pandemic hit, and we were starting to work on it. We will resume working on it almost imminently. And that was that the cost to society is so enormous to have individuals that are houseless in our society. The impact is so great on Queens Hospital. It's amazing. They will tell you that individuals who are homeless and repeat users of their services cost so much in terms of manpower and just general over cost and over expense, that we're foolish to not be making sure that everyone has shelter and food. And so that's why we've started some institutes. The H4 Institute is one that many have committed to. Special thanks to Jill and Queens, HPH also, and HAH. Everyone's chipping in. We solve those problems, then we get to turn our attentions to some of the larger societal questions. And those are like behavioral health, universal access to behavioral health care, the inequities based on race, and so on. But that, in my opinion, should be the push for the next decade. Everyone gets a house, everyone has food security, and a living wage.
Hard to argue. Hard to argue that statement, and that would be wonderful if we could take leadership in that here in the state of Hawaii. I think a couple of you have talked about telehealth and how important that's been for delivering healthcare, but also for health education, primary care delivery, prevention, education, all of that. But we also seem to have in this state some of the same issues related to access to broadband. Now, some of that's improved because when our educational system shifted to online, it was obvious we needed to do something quick, or entire swaths of the population, particularly the rural areas that the Lieutenant Governor was talking about earlier, have access to education. So telehealth benefited from that. But what do we think are some of the areas that we need to really pay attention to in broadband? Hilton, from a broader perspective, from all the healthcare agencies that you represent, what are you seeing in terms of, we know there's growth in telemedicine, in providing care, but how does that link in with partnerships with both the government here at the state level, as well as the private sector in providing access to telemedicine?
Well, the pandemic was an incredible opportunity to really kickstart what has happened with telemedicine, both in Hawaii and across the nation. It has been around for a number of years and has been used sparingly for a variety of reasons. One of the areas that was being used most frequently for prior to the pandemic was for psychology and counseling, behavioral health services. But it really demonstrated, as Dr. Jill Green mentioned, the numbers that she quoted, has really demonstrated how effective telemedicine can be. And going back to that earlier question about equitable access to care, we cannot set up we just don't have the funding to set up, for example, neurosurgery programs at every community across the state. However, using tools like telemedicine or that type of technology, we can provide access to care. You can't actually do the surgery remotely, but in terms of the screening, in terms of the follow-up after surgeries, for example, in terms of communication between primary care and specialty care, this pandemic has forced us to look at alternative ways of providing care, and it has created a much broader audience, or has given us a much broader audience. So many more people have tried telemedicine and found out that it does work. Now, we do expect that some of those numbers will come down as the pandemic eases and people are more comfortable getting back in the office, going to a doctor's office, for example. But you just think about the time involved, for the normal person just to go to a doctor's visit. By the time you drive there, you park the car, you go in, you sit in a waiting room, you see the doctor or the nurse, and then you get back, it could be, an hour and a half, 2 hours, whereas you're only actually spending, 10, 15, maybe 20 minutes face to face. So it can be very, very efficient. I think as a lot more people have used it, a lot more, it will continue to be used ongoing. Now, we do have broadband issues, and that's something that we need to invest in. Hopefully that will be addressed through the infrastructure programs and the investments that the federal government is talking about. Again, for rural areas like Hawaii, you can't do this type, you can't use the technology if you don't have the infrastructure to provide it. And so there are multiple opportunities to use this. I believe this will be an area of medicine that will be much more widely adopted and will stick for the future, and we'll figure out even more ways we can do remote monitoring, for example. You can share someone's weight, their blood pressure, their diabetes, their A1C levels. You can do all that remotely. And so I think there's some very exciting opportunities for us in the future.
Yes, I think you're right. And that addresses the equity question, certainly. And also all the infrastructure bills at the national level hopefully will help with building some of the broadband access throughout the whole country. But that's going to impact our education system too, because we've learned by doing, but we now need to incorporate how to conduct appropriate telehealth appointments, how to get the best out of those relationships. All of us have been on dozens of Zoom calls, and we've gotten better with time, hopefully. But at least the cameras are straight now. But I think that all of the educational programs in the country, particularly those focused on health, on mental health, on physical health, on behavioral health, all need to really look at not only different ways of delivering care, but how to establish relationships remotely, online, and that will make a big difference. And I don't think much attention has been given to that. We certainly have included those, and particularly we were there with behavioral health beforehand. We have a PsyD program, clinical psychology, as well as psych mental health for at the master's level for counselors, and telehealth was always part of that. But we haven't really done that much in nursing education and medical education to the same degree. So I think that will be part of our future in educating people. Now, we've had a couple of questions for the audience. One of them is dealing with burnout. We read about nationally lots of burnout, certainly in the acute care settings during the peak of the pandemic, when there was so much unknown. It was really hard for those providing direct care. So Jill, would you like to address that a little bit? What happened then and how your staff is dealing with that right now?
Absolutely. And again, that's a very, very important question. When you think about our caregivers, and I call everyone that's in healthcare a caregiver, our nurses, our environmental service technicians, our physicians, our therapists, it put you back in March and April of last year when we knew very little about this disease. We were learning extraordinarily rapidly, and on island, we didn't have all the supplies we needed. And I really appreciate all the support we had from our federal and our local, state and local leaders who helped us get the supplies we needed. But could you imagine the courage it took to go into work every day, when you're worried about what it's going to do to you, whether you could be harmed or whether you could harm your ohana. That was happening every day. And what I saw was inspiring courage and great compassion that for months, every day came to work, teams working extraordinarily hard. Frequently, I so appreciated Hilton's support and many of the providers around the community who created hotels for heroes. I mean, they were scared to go home, so they had other places they were staying. But that impact of seeing at our peak, we had 120 patients a day. We had 6 units full of COVID patients with COVID. Our ICUs were at the tipping point. And when you think about the amount of pain and suffering our caregivers saw, as well as the rigor and the intensity of the work, of course, there is a dramatic potential for burnout. And one of our goals is to not lose anyone to our professions, whether it's nursing, physicians, therapists. And I see I call it the second wave of COVID. Most of our caregivers just put all of their energy and compassion into taking care of each and every person. But there comes a point in time where now it's changing and it's getting better, where frequently a lot of that unfinished business of how did that feel and what did you actually go through needs to be processed. So we've been providing behavioral health support throughout the time, because we believe that that's so important. And all of us, all of our families who have been in quarantine and staying at home or worrying about their ability to have their job, the anxiety is high and the depression is higher than it's ever been. But for our caregivers, we've been doing debriefs. We have teams that are going to different units and having ability for team members as a group to process what they've experienced. We will focus for the next year on how do we support the health and well-being of our caregivers, because it will take a lot of time, both individual time as well as group time, because we have an amazing group of people that were extraordinary. And every time I talk about it, I get teary, but really they are extraordinary. And the behavioral health, the emotional component, the pain and suffering that they have and where it can come out, our goal is to prevent PTSD. Our goal is to assure that people are supported as they continue on with their work. So I think it's critical. I think it needs to be available to all of our community. We talk about having availability to primary care. We need to have availability to people that can guide us. And in our schools, our nurses, we've got some great programs from University of Hawaii where we have the school nurse program. We need them supported with mental health provision, because we're going to have keiki that have a lot of implications for the support they're going to need going forward to catch up.
Yeah. And as this whole conversation is about looking forward. And as Hilton indicated, this isn't one and done. We're into a new era internationally within the entire world with viruses and variants, and we're learning as we move along. But we need to pay attention, as you well pointed out, for the mental health, behavioral health needs of those caregivers and the families. Mary, can you talk a little bit? You're in the community where people go back to their community, and grandma died or auntie died, and the children are at home because they're not, or were at home because they weren't in school. What are you seeing as some of the challenges for your community health workers and those working in your community center who provide primary care as well?
Yeah, well, I think it's all of that. What Dr. Jill Green just expressed is certainly there. But, on top of that, what COVID caused, and so much of what we do in our healing professions is about touch. And that got completely eliminated. We purposely moved staff away from each other so they could be separated. When we had configured spaces to be more relational, that all changed in an instant overnight. And I think that that's what our families and our patients experience, that everything was separated. Our waiting area that looked like a living room now looked like 6 individual chairs, so much of that change that led to a feeling of isolation for both our staff and for our families. I think some of the challenges our families faced was the idea of their children not being in school, they're being laid off from their jobs, their income dwindling, and I'm sure feeling like what's going to happen to their health insurance. I think those were all challenges that they experienced. But one thing that I found being in communities are very resilient, right? They will step up. Community organizations will step up. And if there isn't an organization, there is a family that will step up in the community to help get the resource needed for other families, whether that's childcare, whether that's food provision, whether that's transportation. They will step up to help provide those resources, to talk with one another. What COVID also did is we had to pull back on direct outreach to families. So while we may be doing contact tracing and delivering food and supplies, we're not coming in direct contact with them, right? We would ask them, where can we leave it? We'll ring the doorbell, leave the package, let them know that we left it there, leave, and then they come out and take it. So just going through all of those experiences of how we have contactless, contact or relationships was certainly a challenge for our families and for our healthcare providers.
I imagine so, because people work in community health centers because they want that direct contact with the community, the physical contact. So that's very difficult. So we've got a few more questions from the audience, just some of the general questions related to vaccinations, related to travel a little bit, questions about our Pacific neighbors relocating here to Hawaii for healthcare and what kind of impact that's going to have on our public health as well as our healthcare system in general moving forward. Dr. Josh Green, why don't you answer that one? I don't know how big of an issue that is. I don't think it's a huge issue yet, but there seems to be some feeling amongst a couple of the participants or the people who are listening that seem to think that people are going to be coming here because we've done such a good job in managing COVID. So what are your thoughts on that?
Well, that's a brilliant observation. So by them, so we are going to see that. There are two different competing forces. One, because of poverty and because of the great cost of living, some people have felt that they may relocate and go to the mainland, so we would lose population. But because of the very large sustained, foundational support from the federal government, keeping people kind of afloat, we didn't end up seeing the exodus that we might. And it looks like we're going to see some safe haven phenomena coming to Hawaii. Now, that won't be a lot of people, but it will be a lot of very wealthy people, which will have some positive and some negative impacts. The wealth that comes if it develops industry that provides jobs or provides big time investment into our infrastructure, especially education infrastructure, will be good for us. So we will see that. Hawaii had by far the lowest rates of COVID and lowest mortality rate, and is fundamentally safer because of the Pacific Ocean. So that's happening. And then there will be a third potential wave, which is individuals from the compact free states relationship and agreement that we have, where there could be more individuals coming from the Marshall Islands and so on. So I think Hawaii is going to be very popular. I think that over the course of the next 10 to 15 years, we might very well see an expansion of our population after having a downturn for a couple of years. It's a fascinating dynamic to watch all of it go. Now, at this moment, I would really just like to focus on getting 50,000 houses built and housing units, whether it's affordable rental or otherwise, solving the problem we have it's actually 15,000 individuals, unique individuals seek access for homeless services, and getting just some basic, I don't know if the right, living wage provisions put into place. Just doing those things are good enough. there is room, it turns out, to build in Hawaii. There is room to accept both those who have who are affluent and have assets, and those who aren't. There's going to be a lot of expansion in the neighbor islands, I would expect, in the coming decade, but that means all kinds of things. That means that we have to expand schools and whatnot. So we will be flavor of the month, I believe, after COVID, because we demonstrated some sustaining opportunities, mainly that you won't die from COVID as likely. But we all know, those of us on this conference, we know that the disparities are profound for those who just don't have as much resource. So we're going to have to commit to that. Otherwise, we'll just have more people here, more very wealthy people that found safety here, and even more individuals that can't find healthcare. So all of these efforts are going to be enormously important going forward. We won't be able to just buy ourselves out of this problem. It's going to take an actual philosophical shift in how we govern.
A good point. Hilton, do you have thoughts on that?
Yeah, in terms of where we're going, we are incredibly fortunate to be able to live and work in Hawaii. U.S. News and World Report came out a few weeks ago, healthiest state in the nation again. We've done it before. As the Lieutenant Governor just mentioned, going back to the start of the pandemic, when we started collecting national statistics, March 7 of last year, Hawaii has the lowest infection rate in the nation for the entire pandemic, and we have the lowest death rate in the nation for the entire pandemic. So we are an incredibly safe state. Now, that being said, we still have 460 some deaths in the state. But when we were first looking at this pandemic in our initial models, the low end of the death rate that we were looking at is 2,000 to 3,000 deaths, and the high end was 8,000 deaths. And that was what we were looking at, the initial models were looking at. So we have done incredibly well despite the sickness and the death that has occurred. So one of the other great things about Hawaii, and Dr. Jill Green has used this term a number of times, the ohana, the aloha spirit, the community spirit that people have. I believe that a number of the issues that we're talking about are solvable here in the state of Hawaii, whether it's homelessness, whether it's behavioral health. These are finite problems, and there are solutions to these problems. It's going to require collaboration and cooperation between the public and private sector, but there's an incredibly strong desire to address these issues. And I believe with the right leadership in the big square building and the right leadership, and we've got a lot of really good dedicated people out there, that we can make these things happen. We can make an incredible difference. Do we have some really structural fundamental issues that we need to address? The economic impact of the pandemic and the disparate impact on women and people of, on lower income. Yeah, that's an incredible challenge that we've got to face, but can we address those? Can we solve those? We can't eliminate them. We're never going to eliminate all the homelessness. We're never going to eliminate all the poverty, but can we fix a lot of these issues, address a significant part of them? I'm very, very optimistic that we in Hawaii can do this and improve the standard of living for everyone here in Hawaii, because every person we get off the street, every person we find a house for, every person's health we improve, that's good for all of us, not just for that individual.
Yeah, excellent points. And I think that's a good segue into another question that was asked by several of the folks on this call. We've got the challenges, the immediate challenges of getting everyone vaccinated. Before we actually went live, Jill, Mary, and I were talking a little bit about supply issues, and then some of the issues related to acceptability and what some of those challenges are. So Mary, do you want to talk a little bit about how you think we can make the vaccinations more acceptable to larger groups of people? Who needs to be in the conversation and who needs to be part of the solution?
Thank you for the question. So I think definitely the community needs to be part of the conversation and part of the solution. think for Native Hawaiian and Pacific Islanders, we want to move away from the term vaccine hesitancy and talk about vaccine confidence. And how do we improve that? How do we create that? And some of that has to do with access, with getting access to where community members are so they can get vaccinated. Some of that has to do with being sure that accurate information is being put out in a way that they can understand it and by people who they trust to deliver that information. I think the other is encouraging them. One of the surveys that came out that was done by Department of Health showed that a number of individuals rely on their medical provider, and they are highly influenced by their medical provider. So we encourage our patients that if they have questions about the vaccine, particularly as it relates to any of their chronic conditions, we encourage them to talk with their provider about it, and we help to facilitate setting up an appointment for that. And our providers are very supportive of them talking with them. So that's one route that we go through. So I think doing that, providing support through the entire vaccine process, from registration to completing the pre-vaccination checklist to getting to the vaccine site, all of that. What we've done is we call the patients, our patients, directly on the phone. And we complete the pre-vaccination checklist with them over the phone, as opposed to posting it on the internet or having them download it. So I think having processes that are accessible and understandable by patients helps to build vaccine confidence. I think there's also been where we may have seen, say, those 75 plus or 65 plus may have been, quote, hesitant to get the vaccine, or they have shared with us that, no, I want to wait. So how we understand it is, you know, they are in a household with other family members who are much younger than them, and they were not yet eligible to receive it. So they would like to see, well, how is everybody else getting it? So I think now we're seeing that there are many of those that we reached out to that are now interested in being scheduled for the vaccine. So I think for Native Hawaiians, there's just a period of observation in seeing how things are going before saying that, well, how come there's such hesitancy, or how come we're not seeing the rates as high as we should see? I think we need to understand that and build up the confidence in vaccines by addressing some of the concerns that communities have raised.
Yeah, good point. And I think it's a group responsibility within the communities that you're part of in providing education and certainly support in any way that you can. Dr. Jill Green talked about one of the challenges, of course, is supply. And which is why we're not down to the 18-year-olds yet, and still at the 60 and up. Do we see any changes in that supply, Dr. Jill?
Oh, yes. And I want to make a comment. We learn at Queens, we learn from Dr. Oneha and Lieutenant Governor's team and the Department of Health team. We're learning every day about how to support, how to be a part of the community, how to educate. And I truly appreciate the work they're doing in creating access points for either individuals that have a difficulty accessing and traveling, and or really want to have the care, the vaccine in their community with somebody that they know and trust. So as we think about vaccines right now, I am encouraged. So we definitely had, February was a difficult month in terms of getting vaccines on islands. And that made it, slowed us down. There's no question. Here at Queens, we have a goal of, we're going to give 5,000 shots a day. Right now, we're averaging between 2,500 and 3,000 a day. But to get us vaccinated, we've got to go faster. The only limit has been vaccine. What we've seen in the last 2 weeks, supply is going up. I'm very encouraged with President Biden's goal of everyone has access by May 1st. And I'm hearing today that that's potentially moving up in the month of April. So what we're seeing is increased production. But there's always, for me, as we know we're on an island, we've got to see it leave that production site and get to our island and know that we're ready. We are absolutely focusing on our staffing so that as quickly as we have the vaccines on islands, we'll be working with wonderful teams going into the community as well as our access points, because it's essential. And both Hilton and Dr. Green may have more information about today, but I've been excited this week with the amount of vaccine that hit the island, and we're getting ready to put more into people's arms and open up more slots.
Okay, Lieutenant Governor, any other updates on supply issues?
No, Jill's right. Our supply is up. It's not over the top, but we got 90,000 doses, I'm sorry, coming in this week. We were hovering around 50s to 60,000s originally. And the president has asked us now to move our date up to April 19th, which is a week from next Monday. And I've humbly asked Director of Health to approve that. That may mean that some people schedule appointments a week or 10 days out, or even 2 weeks out, but that's okay. I think that certainty is important. Also, there has been an increased number of cases on the mainland and actually in Hawaii, interestingly, but the cases have been amongst those who are younger and not vaccinated, which means that fewer people are being hospitalized based on a percentage of those. And we're really trying to push hard, because if you don't have virus circulating, it can't replicate. If it can't replicate, you can't get mutations. And so that's obviously the basic science on it, but that's a long way of saying I do think that the pressure is appropriate and should be immense for us to open up at least all of the scheduling by April 19th. And if we don't, you can imagine there will be heck to pay from society, because it's just too important. And I'm encouraged. You've seen already that the neighbor islands have moved down to age 16. And a lot of people ask, how can that be? Well, they've been having difficult times finding enough people to sign up who are in the, our kupuna category, or then age 60 to 65, or those with serious and persistent health problems like the lung problems and oxygen dependence, chemotherapy, and on dialysis. So they naturally move forward. And as a neighbor islander, we always have a rogue intent to move forward a little bit when we're away from Honolulu. But now everyone should move forward on April 19th. I don't know why I keep saying August. I guess it's August is when I figure we are going to have vast herd immunity, maybe even July, but it'll be really nice on April 19th or shortly thereafter to open up.
And I think this is a time to just remind everyone, in the meantime, we still need to continue to adhere to all the public health recommendations, mask wearing, certainly social distancing and washing your hands, et cetera. Critically important now. We can't give up now because we're almost there. Almost to overtime, Jill. Your fourth quarter analogy, we're almost there. So, well, I'm afraid the time is running out. This has been a very engaging discussion on all levels. What, at the very front end, what can we do here in Hawaii to make this a better place to live and to deal with the social determinants of health? To the very other end is, how do we get everyone vaccinated so that we can move on with the hard work of continuing to build our public health infrastructure, build our telehealth capabilities, build our healthcare workforce, so that we continue to have a healthy Hawaii. And I know we're all committed to that. So I want to really thank all of our panelists today for your ideas and solutions and taking the time. Lieutenant Governor Josh Green, Dr. Jill Hoggard Green, Dr. Mary Frances Oneha, and Mr. Hilton Raethel. All your representing all different sectors here of healthcare has been a very interesting conversation. I want to thank all of you, and we all look forward to continuing this hard work together. Mahalo and aloha. Thank you so much.
Thank you very much. Aloha.
Thank you. Aloha.